Good day, everyone. My name is Genesis Kim Icaro, a registered nurse in the inpatient department of the Biophysiotherapy and Rehabilitation Center, and today I'll be discussing about bladder training. So, how does the urinary system works? Think of the bladder as a large balloon with its stem, the urethra, pointing downward. The kidneys sit at the top of the bladder, and their job is to filter the blood and make urine. Two tubes, the ureters, carry the urine from each kidney into the bladder. As the bladder fills, the pressure builds inside the bladder muscle. This sends signal to the brain that the bladder needs to be empty. The brain then makes the conscious decision to release the muscle at the end of the stem with the external sphincter, which will allow the urine to flow out at an appropriate time and place. Remember that the bladder will squeeze as a reflex reaction if the patient is not physically or mentally able to hold the stem of the bladder closed until patient reaches the toilet. Therefore, a change in patient's urinary continence can be a sign that something is wrong with the patient's physical or mental health. Factors contributing to urinary incontinence are delirium, symptomatic urinary tract infection, side effects of medications, depression, immobility, fecal impaction, and appropriate physical environments, which are all potentially reversible causes of urinary incontinence. It is critical to understand that incontinence may be a sign of a problem that may have very little to do with the functioning of a patient's urinary elimination system, and that continence is generally not caused by old age. So, what is urine? Urine is normally clear liquid that is pale yellow in color, does not contain sediment, shreds of mucus or blood, does not have foul smell. Every 3 to 4 hours urination while awake. Many older people wake in the night once or twice to urinate. Urinating more frequently may be a symptom of another problem. It is important for the nurse or the nursing assistant to make sure that the patient is getting adequate fluids. Inadequate fluid intake can mean inadequate fluid output, which can cause urine to be more concentrated and to have a dark amber color. Due to the concentration of waste products, this type of urine may also have a foul odor. It is very important for the nurse or the nursing assistant to ensure that the patient is well hydrated to prevent infections that could alter a patient's continence status as well as the overall physical well being. It is essential for the nurse or the nurse assistant to be aware of the patient's normal urinating pattern and the quality of urine to quickly identify and report change that may be symptoms of a more complex problem. The nurse assistant should immediately report to nurse or doctor any of the following symptoms, such as any new episode of incontinence, changes in the quality or color of urine, changes in the urinary frequency, changes in the patient's urge to urinate, urine leakage, changes in the patient's awareness of being wet or dry, changes in the patient's ability to report need for toileting on his own, patient complains of burning sensation while urinating. So, what is urinary incontinence? Urinary incontinence can increase the risks of falls, irritate the skin, cause infection, and make pressure ulcers more difficult to heal. Programs that aim to reduce incontinence should be focused on improving the physical and psychosocial well being of the patient, as well as reducing the costs associated with the incontinence care. Training staff to successfully implement bladder retraining programs may be the best investment an administrator makes toward improving the overall quality of patient lives in a long term care facility. So, what are the types of urinary incontinence? We have distress, urge, overflow, functional, and mixed. So, let's go through them one by one. First is distress incontinence. It is caused by too much pressure above the bladder. The urine in the bladder then adds to this pressure and pushes on the muscle that controls the urethral opening. To treat these, the patient should be taught to empty the bladder frequently every 1 to 2 hours to avoid putting extra pressure on the muscle. Patients should also be encouraged to practice Kegel exercises to strengthen the muscle that leads to the urethra. Wearing protective liners or undergarments can help the patient to avoid embarrassing accidents. Many people with stress incontinence choose to treat the problem by only wearing protective garments, but they should be taught that this type of incontinence may be greatly improved by frequent toileting and Kegel exercise. Urge incontinence may experience leakage because patient lacks the strength to hold the muscle closed that controls the urethral opening long enough to make it to the bathroom. Overflow incontinence is caused when the bladder muscle becomes weak, failing to contract as it becomes filled. Occasionally, incontinence may occur after a patient has Foley catheter removed. In this case, the weakness is caused by lack of use. With the catheter in place, the bladder muscle does not expand and contract normally. As the bladder becomes too full, a small amount of urine leaks out, hence the term overflow, but the bladder does not continue to contract properly, causing more of the urine to remain inside the bladder. If the nurse assistant observes that the patient is frequently incontinent and has small amounts of urine that trickle out, nurse assistant should alert nurse that this patient might have overflow incontinence. If necessary, the nurse will insert a catheter into the patient's bladder to drain the remaining urine. If a large amount of urine is removed during this process, it will become clear that the patient has overflow incontinence. Should also carefully monitor the patient's intake and output. Periodic catheterization may be needed to get patient's bladder muscle back into the habit of expanding and contracting. The nurse may use Crane's maneuver to empty bladder by applying manual pressure to the top of the bladder and push down towards the pelvic region. This helps the bladder to empty. Functional incontinents are those patients who do not have the cognitive ability to communicate the need to urinate. The treatment plan for the for the patient with this type of incontinence includes prompted voiding. Mixed incontinence. It's a combination of urge and stress incontinence symptoms. Usually one type of symptom is most prevalent. The treatment plan for this base is on which type of incontinence is most prominent. So what are the bladder training programs? We have the bladder retraining or graduated voiding, pelvic muscle exercise or Kegel exercise, prompted voiding, and timed voiding or habit training schedule. So bladder retraining or the graduated voiding. It is designed to lengthen the number of hours that an alert client can wait between voiding. It strives to increase the client's bladder capacity and achieve a more normal voiding pattern. What are the techniques? Remind the patient to use the toilet or void every 1 to 2 hours and continue this pattern for a week. Then gradually lengthen the number of hours. Indication for use. This is for patients who are having urge or stress incontinence. Criteria. The patient should be alert and cognitively intact, has access to toilet, can initiate voiding. Pelvic muscle exercise or the Kegel exercise. These are exercises that strengthen the pelvic floor muscles, which help control the flow of urine. Techniques. So teach the patient to tighten the pelvic floor muscle by instructing him or her to try to stop the flow of the urine while voiding. If able to stop the flow of urine, then the patient has exercised the right muscle. Encourage the patient to exercise this muscle by squeezing and relaxing it for 10 to 15 minutes. So indications, this is for urge and stress incontinence. Criteria, Patient should be alert and cognitively intact, has access to toilet, and can initiate voiding. So for the prompted voiding, it is a behavioral technique used to promote continence in patients who are dependent or cognitively impaired. It involves family member or caregiver to remind the patient to use the bathroom. Caregiver or family member should praise the patient for maintaining continence and for trying to go to the bathroom on cue. So this is for patients who are experiencing stress, urge, or functional incontinence. Techniques are: ask the patient if he or she needs to void and whether he or she is wet or dry. Praise the patient if he or she correctly acknowledged the need to void. Criteria: patient should have access to toilet, some cognitive impairment but must be able to ask to use the toilet, willing to try toileting. Timed voiding or habit training schedule. Voiding is an attempted based on predetermined time interval. No goal to prolong the time in between voiding attempts. Assist the patient to void on a schedule based on the predetermined intervals, typically every 2 to 3 hours. Increasing or decreasing voiding interval may be needed based on results. Indications for urge incontinence and criteria: patients who are cognitively impaired with memory loss or no awareness of the urge to void. Urinary incontinence products. These products will provide temporary relief while waiting for bladder training programs to take effect. Surgery and medications are not an option, and the use of urinary incontinence products may become a long-term option. Wide variety of products are available on the market that can be ordered on internet or from grocery store. The ease and availability of products should not be a substitute for toileting programs which are designed to maximize continence. These products include pads and protective garments. Summary. So the urinary incontinence is a significant health concern with long-term care patients. Preventing and treating continence plays a significant role in a patient's all over quality of life and risk management. Understanding the normal function of the urinary system and basic treatment techniques for incontinence provides nurse assistants with an educational foundation that is needed to provide care in a variety of long-term care settings.